Hi, my name is Justin Riffle, and I have just completed my internship in the pharmacy at TJ Samson Community Hospital. I spent most of my time at the inpatient pharmacy, but I also spent some time at the outpatient pharmacy, which is the retail, and also the oncology pharmacy. So first, let's talk about the inpatient pharmacy where I spent most of my time. The pharmacists at the inpatient pharmacy were required to look over the patient's information in the hospital to make sure that the doctors were not giving any medications that would counteract and cause a dangerous reaction in the body. So when I shadowed a pharmacist, a lot of times they were on their computers looking over everyone in the hospital. They weren't doing anything else with drugs, medications. They were just sitting on their computers basically all day. They also would go check IVs sometimes, and when the pharmacy techs were restocking to fill up their machines and things like that, they would make sure everything was right, like the number of pills in the bag, or the IV count, or how many they were put on the shelf, things like that. I was told that they were short a couple pharmacists. They had like 4 or 5, and they usually have about 7 or 8. And this would allow them to have a couple pharmacists to go out onto the floor with the doctors to help talk to the patients about the medications that they were being given. I also shadowed and worked with some of the pharmacy techs at the inpatient pharmacy. During this time, I went out into the hospital to the different wings, departments of the hospital to restock and load different medications into the Acadose system. The Acadose system is their way of properly dispensing medications to the patients because the nurses were only allowed to pull the drugs that were prescribed to that certain patient. Also, while working with the techs, I checked all their prescription drugs they were put in the machines to make sure they were not out of date. So they had a big shelf of medications in the pre-prescribed, already packaged, and I had to go through every one from A to Z to make sure they weren't out of date. So, like, I had to pull them if they packaged them at the hospital. I had to pull them if they were going out of date within a month. But if they were pre-packaged at a company, I had to pull them within 3 months of their expiration date, because then they would send them back and try to get some money for them. So I also helped organize all of their shelves. So if they had over-the-counter medications or anything else that wouldn't fit on their pills, that's where I had to reorganize it, put it in alphabetical order, which this took me so long. I did this for probably 3 days, 4 days, something like that. It took most of my time at the inpatient pharmacy. During my time at the inpatient pharmacy, I did learn a lot about the different drugs and how pharmacies ran in a hospital. Each day they had a meeting to go over any accidents or concerns that happened the day before. This seemed very professional and allowed everyone in the department to be on the same page. One of the pharmacists even gave me a list of drugs so I could start getting to know some of them, and some prefixes, suffixes that many of the drugs have to specify to the class they came from. I also had to give a presentation on a new drug that one of the pharmacists gave me to research. This drug was Baxdela. It's a new antibiotic that the FDA just approved, so it ain't really on the market yet, and they didn't have a price on it. So I just had to do a quick little presentation to some of the pharmacists, which they said it would help me later on when I get into pharmacy school, because I would have to do this to other people in pharmacy school. The inpatient pharmacy was a great way to introduce me to a hospital pharmacy. Next, let's talk about the outpatient pharmacy, or the retail. So I wasn't at the retail pharmacy that long. I was there, I think, 1 day out of how many days I was there. I was there 12 days. But I got to see the new program that they just started. It was called Meds to Beds. This program allowed for patients to get their prescriptions filled before they left the hospital. The pharmacy techs would take the prescriptions to the patient's rooms. They would pay for it at the room so they could have them when they were ready for discharge without having to go to their local pharmacy or have to worry about, once they get out of the hospital, having to worry about going to a pharmacy to get their prescription filled and then waiting longer. So it kind of took that waiting process out. They could get them before they left the hospital. And I also watched the pharmacy tech and the pharmacist work on different patients' orders and fill the prescriptions. So it wasn't just for inpatient pharmacy only that they would come in and get the pharmacy their medications there. It was like an open public pharmacy, so anybody could come in and get their medications filled. It wasn't just for people at the hospital. The pharmacists at the retail pharmacy did seem to be more involved, though, with the drugs and more involved with the people receiving medications than the people in the inpatient. So the pharmacist and I talked for a while about the path I wanted to take in the pharmacy, whether I wanted to be in retail or I wanted to be in a hospital setting. We debated on it for a while, and I figured out I would rather be in a retail setting than a hospital because I felt like I was better with people. I work at Mammoth Cave right now, and I can interact with people pretty good. I can handle a pretty tough situation, and I like to interact with people on a daily basis. So the people upstairs, when I talked to them at the inpatient pharmacy, they were saying how they didn't want to deal with people, they didn't want to interact with people, all this stuff. They didn't want to be around people, which I'm fine with that. So I felt like that was better for me than sitting upstairs behind my computer. Lastly, let's talk about the oncology pharmacy. This was the most interesting of the three pharmacies. In this pharmacy, they made the chemo that is used for chemotherapy. I got to suit up with a hairnet, booties, and even a lab apron. I mean, you're talking about Breaking Bad, Walter White style lab. I had to place this on to even enter the lab to make the chemo, to see him make the chemo. I couldn't even touch any of the medications or anything like that. So just to watch them, I had to put all this on. The lab was very sterile, and they followed very strict protocols to make sure that the environment wasn't contaminated. They had to maintain a certain temperature and humidity in the rooms so that the medications didn't get over a certain temperature or they wouldn't work anymore. They had lines telling you where you could walk, where you couldn't walk. They had red lines everywhere throughout there, telling you where you could walk or where you couldn't walk. You had lines telling you where you could touch, what was sterile, what was non-sterile. You had to wear gloves. You had to put extra gloves on if you were something that was hazardous to the human body. The pharmacist would have to come in, check the chemo, take it out to the patients once it was done. So not only was the pharmacist making the chemotherapy, but also interacting with the patients. The oncology pharmacy to be more scientific. You could actually be working in a lab, mixing medications, mixing chemicals, which seemed to be more fun to me. I don't want to just sit on my computer all day looking over people's information and seeing if anything's going to counteract. I'd rather be actually working with the chemicals, making medications, I'd rather fill pill bottles all day than have to sit up on my computer, but it's whatever. Overall, I had a great experience on my internship. It gave me a great idea of what I would like to do once I get into pharmacy school. I didn't really like the hospital setting. I've said that probably a lot now, that I didn't really like hospital setting. A lot of times during the day when I was at the hospital, I would just sit there at one of the cuticles that they had, and I would just sit there and read over some flashcards that I made about some different medications that I should learn, things like that. So I didn't really get to do much at the inpatient pharmacy. But when I got to go to the oncology pharmacy and the retail pharmacy, I was actually doing something. I was actually getting to see stuff that I was more interested in than just sitting at a computer. I felt like I was interested more in the oncology pharmacy and the retail just because they were more interested in interacting with the patients and filling medications, making the medications, things like that. The inpatient pharmacy just seemed to sit at their computers, like I said, and I'd rather interact with the patients. So this internship was a great way to introduce me to myself and my future career. It took me, I worked for 40 hours a week, so I worked Monday through Friday from 8 to 4 for 2 weeks. I did that, and then 2 days after that, I worked 2 10-hour days, so I could get my total time within 2.5 weeks, so I didn't have to miss work back at Mammoth Cave. But I had a great experience. I met a lot of people. The director at that inpatient pharmacy said anytime that I need any clinicals or anything else when I get into pharmacy school, he would help me out. So it was a great way put myself out into the workforce. So hopefully later on in life, after I get out of pharmacy school, I have a chance to get into one of these places, or they can put their name in for me, so maybe I can get a good job after that. But thanks for listening and have a great day.